Hi everyone, my name is Vasavi. I'm a master's student at San Jose State University and I'm specializing on stem cell. I'm also a Cirm scholar where uh, they fund for stem cell researchers and clinical trials.
I'm here to talk about the stem cell research that's happening across California through Cirm's funding. Before I move on to what we do in the stem cell research, I would like to brief you on what stem cells are and its importance in various diseases. Stem cells are primitive, unspecialized cells that has the capability to differentiate into, or in simpler terms, divide into specialized cells. So the stem cells can divide and reproduce into daughter stem cells, or they can differentiate into any specialized cells like muscle cells, blood cells, or brain cells. Now that I have explained what stem cells are, let's look into how to obtain them for treating various diseases. There are different ways you can get stem cells. Stem cells are usually pluripotent, which means they possess the ability to differentiate into any type of cells. These type of pluripotent stem cells can be obtained from the embryo. In this, when a fertilized egg divides into cells, they form blastocysts, which has inner cell mass, which are yet to be differentiated. These are called the embryonic stem cells. There are other ways stem cells can be obtained, but they cannot be pluripotent, like cells from the bone marrow, peripheral blood stem cells, and umbilical cord stem cells. But still, these are being used for various research purposes. To overcome this, in the year 2007, there came a breakthrough in the field of stem cells. Dr. Yamanaka, who is a Nobel laureate, discovered iPSCs, which are induced pluripotent stem cells. These are adult cells that are genetically converted into embryonic stem cell-like state. That is, they possess all characteristics of pluripotent stem cells and can differentiate into any cell type. Now that you all know what stem cells are and how they are obtained, it is definitely important to know what stem cells are being used for. Stem cells are an exciting area among the doctors and researchers because of their potential to regenerate and repair damaged tissues. Stem cell therapy are also known as regenerative medicine, which promotes the repair response for any disease, dysfunctional and injured tissue using stem cells. The researchers and doctors hope stem cell studies can help to increase the understanding of how the disease occurred, generate healthy cells to replace the diseased cells, test new drugs for safety and effectiveness. One well-known therapy which extensively uses stem cell is the bone marrow transplantation. Likewise, many other researches have been happening around stem cell to find a cure for various other diseases. When it comes to stem cell in California, Cirm plays a major role. Cirm, California Institute of Regenerative Medicine, which is California's stem cell agency. The primary mission of Cirm is to accelerate stem cell treatment for people who have unmet medical needs. Cirm funds all areas of stem cell that shows promise for the accelerating treatments. Almost 60 clinical trials, around 25 of the funds are into blood cancers and solid cancers. 20% of the funds are into blood and 11% of the funds are into neurological disorders. Apart from funding various therapies, Cirm also facilitates students' involvement for stem cell research through two internship programs. One is the Cirm Bridges, which focuses on the graduate students and graduate students at 14 different universities across California. The other is the Spark program, which allows high school students to learn more about stem cell during the summer. Many patients were benefited with the clinical trials and researches funded by the Cirm. Now I'm going to present you a short video on a patient who herself explains how she is recovering from retinitis pigmentosa after her first clinical trial from Cirm.
He said, "There is no cure." And I was pregnant with twins. It was absolutely devastating to know that I would be a mom and that I would eventually go blind.
Rosie Barrero has been steadily losing her vision since childhood. In 2016, she volunteered for a Cirm-funded clinical trial, testing the use of stem cells to restore her vision. This is her story.
And when I'm 4 or 5 years old, I just thought everyone saw the way that I saw. And it wasn't until I went to first grade, that's when the teacher, she noticed, she said, "We need to have your eyes checked." I went in and they asked me to tell them which direction the E was going, and I wasn't able to see anything on that screen. So I was always nearsighted and wore glasses from the age of 6. And when I was 26, that is when I decided I wanted LASIK surgery. And they told me they were unable to do the LASIK surgery because there was something that they noticed, and they referred me to the retinal doctor, and he confirmed that I had retinitis pigmentosa.
Retinitis pigmentosa is an incurable, inherited disease that slowly erodes the cells of the retina. That's the light-sensitive area in the back of the eye that's responsible for vision.
Over a period of 10 years, there was a significant loss in my vision, and it just disabled me from being able to do the things that I normally did, which was reading to the kids and being able to look at their art and read my own writing or make a list or just mundane, simple things. Experiencing the clinical trial, it wasn't what I expected. I thought it would be much harder. I thought there would be more pain involved. The procedure was very quick, very simple. It was one injection, and I must say, just painless. You know, there's a little pinch. If you've ever had a shot, it's just a shot, but it was in my eye and not a big deal. Before the treatment, I've described my vision as a impressionist painting in a foggy room. It's been 17 months since my initial injection, and it's hard to quantify and describe to people the improvement because although it's minimal, it's still so incredible. My mom said, "I can tell. You're looking at me. You can see me." And I said, "I can, Mom. I can see you." And she just, tears in her eyes. I think she's happier than I am. People say, "Oh, hindsight is 20/20." And now when I think about it, I think, "Oh no, my future's 20/20."
As you saw in this video, many people like Rosie Barrero would be benefited with the research in stem cell. I request you all to support the stem cell research and vote in favor of the Treatment and Cures Initiative for us to get the 5.5 billion funding through the Cirm. I thank you for patiently listening to me, and I hope you do give your feedbacks on this video. Thank you.